Final presentation of the day, saving the best for last, Greenlight Medical. Greenlight was founded on the belief that there is a more efficient way to get life-saving medical technology through hospital procurement and into physicians' hands. Co-founder and CEO Austin Dirks is presenting today. He was a former medical device sales rep with St. Jude Medical, selling cardiac medical devices, where he was exposed to hospital procurement and he was exposed to the dysfunction as part of that process. He founded Greenlight in the summer of 2014 after graduation from Harvard Business School with a vision to simplify hospital procurement through the first ever end-to-end solution connecting hospital providers and medical suppliers. In addition to HBS, he went to Harvard of the South, Vanderbilt, also my alma mater, go Doors. And I've really enjoyed getting to know Austin as part of this process. He's tapped into a really strategic go-to-market plan, and I have no doubt that under his vision, under his leadership, Greenlight's going to thrive. He has already secured some seed funding from Jumpstart Foundry out of Nashville, a highly regarded program, and he's looking to build additional capital into that investment. So with that, turn it over to Austin.
All right, last of the 12. Some of you are excited, more than others. All right, well, let's do this. My name is Austin Dirks. I'm the CEO and founder of Greenlight Medical. But before I tell you about Greenlight, I'm going to tell you a little story. It starts here. That's me, Austin. And I was a medical device sales rep. And I sold to that guy, a doctor. And he was the sole purchasing decision maker for that, a pacemaker. But this doctor, with a limited stake in the financial success of a hospital, made that same high-cost decision on several medical devices. It's a bad omen. What does this amount to? Well, with hospitals concerned about cost containment, in addition to trends such as hospital consolidation and physicians as hospital-owned employees, there was a shift that was enabled. And that shift was a shift in the dynamics of hospital procurement to this, a value analysis committee. In the past 5 years, value analysis committees have grown to over 70% of hospital use for new product purchasing. So now physicians are stuck at the crossroads of fiscal responsibility and innovation and are driving projects through this process. But with 300 to 500 new product requests per year imparted on this process, we have a problem. And that problem stems from outdated tools of execution, such as paper-based new product request forms, with file cabinets, fax machines as our best friends, left to do our own time-consuming research independently, with multiple modes of communication, with each device having its own priority and checklist. This is a great initiative for hospitals, but with poor outdated tools of execution, this process is taking 9 months from introduction to available shelf use by physicians. So why does this matter? Well, time is money. And for every 9-month delay, there is an estimated $8.6 million attributed cost to medical device companies, rising the cost of medical technology for all involved. So what if hospital procurement didn't have to look like this? What if hospital procurement could look like this? We had one real-time, cloud-based, simplified exchange of information, which is exactly what we do at Greenlight Medical. But instead of just telling you about it, let me show you. So with Greenlight, we standardize the introduction of medical technology through one portal. By doing so, we can automate key information to all the key collaborators in the hospital: reimbursement, regulatory, financial, clinical data, and regulate that in a one shared environment where teams can gather, departments can share information, hospitals can share information, and even hospital networks. By doing so, we have a permanent storage for all data, documents, decisions, and discussions. Hospitals have the information wherewithal on an upfront scale to make responsible decisions for their facility on the cost, the quality, and the outcomes of new technologies so that they can make the best choices for their facility. But we're not just a siloed solution for hospitals. We operate with the mentality that connecting the entire value chain, from medical device company to sales rep to physician to hospital, we can manage this process in one seamless exchange and do things with data that we've never done before. This is an example of our market penetration to date with users on both the hospital and the medical technology side, in addition to our partnership with TMCx. We sit in the belly of a magnificent institution with several institutions we are in conversations with now to implement Greenlight. Here's evidence of our recent customer traction to date in addition to our team has deep domain expertise in hospitals, software, entrepreneurship, and medical devices. We're well on our way to this goal. A $1.5 million fundraise with help from people like yourself. Saw some checkbooks. If we can do that, we can get our team expansion to get in place 10 hospital systems in the next 6 months using Greenlight Medical to ultimately fulfill our mission, to put the best medical technology into the hands of physicians to go save a patient's life. Thank you very much. I'm Austin Dirks, and this is Greenlight Medical.